Hello, my name is Dr. Glenn Feltz, and along with Dr. Kent Eichenauer, we co-created the Psychosocial Risk Factor Survey, the PRFS. The PRFS is an assessment tool that helps medical professionals to assess psychological factors that could be affecting a patient's physical and psychological health. The factors that are measured are depression, anxiety, anger and hostility, social isolation, and emotional guardedness. This video is part of a video series on the PRFS, and the next video that you're about to see is Dr. Eichenauer demonstrating how a staff member could give interpretive results to a patient based on their score on the anger hostility scale.
Now, there's another scale here that I want to go over with you. This is called the anger and hostility scale. And basically with anger and hostility, we know that this is a significant contributor. When we talk about heart disease, it's one of those important psychological risk factors. Now, when we talk about anger and hostility, and primarily really hostility, what I really think is important for us to focus on here is that we're not necessarily talking about this scale measuring people that are always kind of red-faced and veins bulging and jumping down people's throats and that kind of thing. But really, what we're looking at here is people that ordinarily seem to have it pretty well together most of the time. But unfortunately, there can be kind of maybe a cynical outlook that people can have of just kind of sort of expecting things to not go right, or for somebody to do something wrong, or it's just easy with this kind of hostile attitude for people to look for who's the next person that's going to cut me off in traffic, or who's the next person that's going to kind of give me the wrong change at the checkout, or those kinds of things. Now, oftentimes people that have problems in this area, there's real, the sense of a need for justice, okay, or for fairness in the world. And that's all just fine, but the only problem is that, as we all know, what our moms always told us was the world isn't fair, and there are going to be things that are going to happen that, there just simply is not going to be justice. And the problem that this runs into is that, not only are things not going to be fair, but we're going to have to figure out a way to somehow let go of that. And people that can have problems in this area, they have a hard time letting go and kind of, not forgiving. And it's, people can sometimes look for, ways to get back at, or to find some kind of vengeance, or that kind of thing. So, people that can have higher scores on this scale are also folks that are probably going to have a harder time letting go, or being able to forgive other people. So, basically, that's some of what we're talking about here. And certainly as people have more problems in those areas, it becomes easier for there to be more things for people to find to get angry about. Okay, so not only is it a problem for that hostility or that hostile attitude to just sort of always be there, and that can kind of keep ourselves kind of keyed up inside as we're sort of vigilant and looking for what's the next thing that's going to go wrong. But it just creates that many more opportunities for us to feel angry. And then certainly that anger even more kind of charges us up on the inside and creates some of those other physiological problems that can end up leading to more heart problems as well. So, I guess my question for you is here, as we look at this, and your scale is in that moderate range, how much do you feel like that applies for you based on what I've shared with you here?